Hi, I'm Janet Gross. Welcome to Coping Today, a place where we talk about mental health and well-being. Today, we're focusing on pre- and postpartum depression. Some studies estimate that 1 in 8 new moms go through this, and many don't realize that's what's going on. Sometimes it's not only mood swings or crazy hormones. So we're going to talk about that. Awareness, symptoms, treatment, and even stigma that surrounds this. I mean, you know, you get advice from a lot of people. Dr. Roy Salgado, counselor, professor of counseling at the University of Holy Cross, is here to help shine a light on this and give us some mental health perspective on
Yes, and it's an important conversation to have because it's so multi-factored, multifaceted, and layered. There's a lot that goes into what a new mother, an expectant mother, a recent mother is going through during this time of life. And oftentimes people ignore it, dismiss it, cast it aside, and move on. And so it's important to pay close attention to it because it's important that we not dismiss the lived experiences of mothers while they're pregnant, because they know their own bodies. They know what's different, they know what's new, and what's the typical experience is. So we need to listen and not dismiss it as something like the baby blues or just some sort of melancholy, because it can be something significant, be it a mental health condition like depression, like postpartum depression or prenatal depression, not just a fluctuation in hormones and mood, or it could be something physiological in nature. There could be something else going on that's contributing to the expressed symptoms, because oftentimes physiological conditions and psychiatric or mental health conditions can mirror symptomology that looks psychological in nature.
And you know, even if it's none of those things, you don't want to minimize somebody else's feelings.
Right.
You know, what is that? You know, you can't, she's going through something that is so huge and so, it's changing her body, her mind, her whole world is changing, and she's got to get ready for somebody else to take care of too. And
that's the point there. You have someone who is in a very vulnerable state, an expectant mother or a new mother who's in a vulnerable state because not only is she now responsible for her own well-being, but the well-being of an innocent, new, precious human being. And then to have others dismiss it, be it, you know, the partner, the spouse, a medical provider, whomever, just say, oh yeah, that's fine, that's normal, that's, you know, that's normal, that's what happens when you're pregnant, that's what happens when you have a baby, you know, it's hormones. And to dismiss it is not helpful to anyone. And we could be overlooking something potentially more serious and the possible adverse impact thereof if we don't listen to what mothers are saying.
Because if this goes to something else, if it develops, I guess, does it develop? I guess depression develops?
Absolutely, and if it's not caught and listened to early on, if we don't hear these expectant mothers or new mothers' experiences early on, then it does become more chronic, and it could lead to other conditions, and it impacts the family as a whole. It impacts the newborn child. Perhaps there isn't a connectivity that happens, a bonding that would take place. The attachment could be adversely impacted because now the mother is depressed and not connecting in a way that she otherwise would if that need hadn't been met earlier. And then how that child develops in terms of they being able to nurture and nourish and thrive, if you will, and all of that. And then the family system as a whole is impacted. And so it's important that we listen early on to anything that a new mother is trying to share with what she's experiencing.
Because this could be a whole big bad snowball that you don't want to run into. Okay, we're going to take a break, but before we do, let's talk about the University of Holy Cross offering a service that can be invaluable to people.
Yes, the Maronites of Holy Cross and the University of Holy Cross have for several years now been offering free telemental health counseling to any resident of Louisiana. So if anyone in Louisiana is struggling with not only pre and postnatal, postpartum type of symptomologies, but any type of mental health issue, they can call the number on the screen. The assistant will go ahead and triage that call to the clinical director, who will then assign a counselor in training to you, and then you will receive free telemental health counseling services for as long as you need.
Sweet, great. A lot of people really need to hear that and get that number. So,
yes.
Okay, great. Well, when we come back, we're going to talk about healthcare providers' attention to these concerns. So stay with us.
You're home before sunrise, on top of the house, the kids, and our future. The smell of your cooking is our alarm clock. My Shiro's day is never done. So let's start saving a little more now so we can feel prepared for retirement. A free 3-minute online chat can give us the personalized tips we need so we can live our lives to the fullest. Visit aceyourretirement.org.
And we're back. We welcome Dr. Rakia Bolden, Counselor of Education and Supervision and an alum of the University of Holy Cross. Thank you for joining us.
Thank you.
I know you did some research on what we're talking about today, pre- and postpartum depression. What did you find out?
So my research allowed me to find that African American women experience, who identified a poor experience receiving health care at a healthcare facility, they felt unheard, they felt dismissed, they felt that they weren't communicated with, and a couple different things that emerged throughout my research across participants. Stereotyped against, they talked about mental health and how they were affected by their experience. But I want to say I had 8 participants. All 8 participants talked a lot about how they were affected emotionally by these experiences. And just going into such a delicate and complex experience such as childbirth, going into it and then experiencing something that was, from their perspective, negative or not as supportive as they had hoped. They talked a lot about how their family dynamics were shifted, how they began to question certain things about themselves, and also how they would try to do things in the future as it relates to planning for future care, making sure that they did a lot of research in choosing a provider, and making sure that they put an emphasis on what they were comfortable with and tried to communicate things that they felt differently about their body, about their emotional state. And I found that a lot of the participants talked a great deal about what they would do differently so that they can avoid having an experience that they were not pleased with.
You know, everybody wants to be heard. And so people who don't pay attention to you, especially your doctor and this kind of thing, you would definitely, I think it's smarter women to think, well, never again, you know?
Yeah, yeah.
Because you would think that your physician, your OBGYN, your medical provider would be open to hearing what you have to say.
Yeah.
And so what else did they say with regard to those experiences that they didn't feel heard?
Yeah, so they talked a lot about identifying certain changes or a crisis that they felt might have been coming up for them, a medical crisis, or any type of feeling that felt off or abnormal to them, trying to communicate these things. And a lot of times some of the mothers felt that certain things they tried to communicate were kind of dismissed and attributed to something else, a pre-existing condition. So they made sure to emphasize that I tried my best to communicate. I tried to make sure that I presented everything that I was feeling, all of these changes, but for some reason it wasn't heard. It was either dismissed or attributed to something else, and as a result of that, it kind of led to a crisis. Some talked about passing out. Some talked about a medical crisis that possibly could have been avoided or prevented if they had felt that their efforts to communicate were valued or heard.
You know, you think that I'm seeing here that maybe the obstetrician's bedside manner could have helped that a lot. You know what I'm saying? If you actually take 5 minutes, listen to them, look at them, you know, and I doctors have a lot. I'm not dissing doctors at all, but you know, sometimes the act of listening is medicine.
Yeah.
You know.
Yeah. No, that's so true, because I recall participants specifically stating, if I was able to be put at ease, my experience would have been better. That was also something that emerged across participants, was that they wanted to feel connection. They missed that. They wanted to feel cared for. They wanted to be, and it also goes in with communication. They wanted to feel that their provider or medical staff wanted to hear their concerns and that they were connecting with their provider.
You know, and to both of your points, you each brought up a point that I playing devil's advocate here, not wanting to diss providers, if you will, that there's a lot going on in a labor and delivery room, you know, so you have people coming in and out, you have nurses, you have doctors, you have other paraprofessionals tending to different things, and perhaps intentionally or unintentionally, the outcome is the same, not feeling heard, regardless as to the things that are contributing to an inability to hearing the mother, the outcome is still the same. I wasn't heard, I feel XYZ. And so to the extent that we, professionals, need to be in tune to that so that we can offer better care, effective care, best practices to expectant mothers.
Exactly.
You know, certainly in the room you described, everything is routine to everyone except one person.
Right. Right.
And that's, you know, she's the center of the whole
delivery
thing.
in room A, the delivery in room B, at 12 o'clock, at 2 o'clock, at 4 o'clock.
I know, I've been through this before. I haven't, you know. She's like, hello.
Right. This is still totally new for me, and that one of the topics within my research was implicit bias, because when we talk about providers and their care, sometimes providers are not aware of certain biases that they present. Like we're talking about, you know, there's a lot of things going on. I think being able to take a look at implicit bias and what it is, how it shows up in the delivery room, how it shows up in care. Also on the side of the patient, are patients aware of implicit bias? Does that influence how they experience the event and how they perceive their experiences? So sometimes it may be something that is intentional, sometimes it may not be something that's intentional or acknowledged. So I think taking a look at that would also be helpful in terms of closing the gaps and identifying how we treat patients and how we kind of balance the scales.
You know, implicit bias is a term that we've been hearing a little bit more of lately, but I think that some of our viewers perhaps could use a more common language definition. Can you tell us what implicit bias is?
Yeah, so implicit bias is pretty much when a person has certain biases that are not intentional, that are not conscious. Maybe subconsciously they are acting or presenting themselves in a way that could be biased towards someone else, but not fully understanding or not, it's almost like not having control in a way over your biases because your experiences or your position as someone who may be overwhelmed, someone who is in an environment that is high paced, that is very critical, such as a medical childbirth. So not being in that position and not fully being able to identify certain things that can be harmful to someone else, it allows someone to act not from the most conscious level of actions or intentions. So maybe they're not aware, subconsciously they're behaving this way or presenting themselves this way, but consciously they're not purposely doing it. And that could be the case in some situations.
So, but I guess, you know, as we come full circle there, every little thing that adds to that new mom's weight, you know, whatever it is, the problem she has to solve, the things that are going on in her body, every new thing that just weighs her down can lead to something that may have longer lasting effects than outside the delivery room, and you know, than inside the delivery room.
Yeah, 100%. You know,
emotionally, all those things.
Yeah, and when we look at specifically African American women who already come into a space such as giving birth, which is something that's complex and already sensitive and critical, coming into this space where they may have already, so researchers have already identified that this population experiences major stressors due to racism and discrimination. So already coming into this space with a lifelong experience of combating these events, they're already, like you said, have a specific emotional state that's already delicate. Exactly. Yep.
Right.
All right, well, thank you, Dr. Bolden, for joining us and giving us your expertise and talking about the study that you did. We really appreciate it.
Thank you. Okay. Thank you so much.
Thank you so very much.
Okay, we'll be back in a moment. Stay with us.
Is it okay to call you Mom?
Of course you can.
Welcome back. And joining us now is Dr. Ann Troy, Associate Professor of Nursing at the University of Holy Cross. Pre- and postpartum depression, this is clearly an issue. What do we need to do about it? What will it take to accomplish or fix this, I guess, or at least make it better for patients or people, moms?
Well, I can tell you from a nursing point of view, we're trying to take away the stigma of all mental health issues and have patients be able to talk about it and have nursing professionals who are capable of distinguishing the symptoms that require further follow-up. So we want to have screening at all levels of interaction with our patients, despite where they come into us for access to care.
Okay, we were talking about this during the break that, a lot of times pediatricians get this, need to talk about this because they're the ones that moms are seeing on a regular basis after they leave the care of an obstetrician.
For years to come after the birth of a baby, that's right, their primary relationship can be with their pediatrician. So it would be extremely helpful for them to have easy tools for screening so a mom could self-identify that she's becoming an outlier, that it isn't just being sleep deprived, but that she's actually struggling with hormones and even some serotonin and dopamine issues that could be attended to.
And that's the important key there, to be able to distinguish between something that is pretty typical during pregnancy and childbirth versus something that becomes pathological that needs to be tended to. Because sure, they're going to lose sleep, right? Women are going to lose sleep during pregnancy and certainly in the weeks and couple of months after pregnancy. That's going to happen. They're going to have some sort of mood changes. That's certainly within what's typical and expected symptoms and experiences within a healthy situation. But to hear from a mother by a medical provider, be it a pediatrician, a nurse, a physician, an obstetrician, a mental health provider, everyone that would be involved in that, to really be in tune to the potential symptoms that a mother is expressing, so that to discern, is this typical or is this atypical? Is this something that falls within healthy behaviors that are just not pleasant because you are sleep deprived and somewhat anxious, as opposed to something that is more that needs more attention? And so we need to all be in tune to this as providers.
And that would be great, because sometimes the mom doesn't know what's going on. I mean, she's got so many other things to worry about or think about. She doesn't know that this is becoming something else, I think.
And then if you're being dismissed or not heard, whether it be intentional or unintentional, it doesn't help the situation.
So, doctor, how do you think that, I mean, obviously you've talked to, if other healthcare providers can look for this, is there a special, lens that they have to see through, or how do we approach this so that people get the care they need?
Well, I can speak to the fact that in nursing, we have been dealing with implicit bias from day one when nursing students come in, so that we have our students aware of their own trauma that they've experienced and how that might impact what they're able to hear or see in a patient, and to really start looking at through a trauma-informed lens, so that we are looking for behavior in a patient that might signify that they've experienced systemic racism, or that they might be coming from multiple abuses in their past that could be impacting their ability to trust and form a relationship where they could be honest with us about what they are needing. And one of the things that I tell students, if you don't understand the answer that you receive from a patient and you find yourself getting judgmental, you've not asked them the right question about their life and what they're experiencing. That is a lack of understanding on our part.
Wow.
I so appreciate that perspective, that if the provider is finding themselves being impacted and then they're responding in a way that is not objective and professional and unbiased, if our stuff is being stirred up, then to Dr. Choi's point, we are not doing something ethical and professional, and that's in the benefit of the patient. And so I so appreciate that perspective.
Me too. That's amazing. And you were talking about it starts, other things happen to get the ball rolling or whatever. So depression isn't just like boom, right? Or is it? It can start over. It has factors that lead and feed into it, so that in pre and postpartum depression, this becomes kind of an avalanche thing happening.
Sure.
Yeah.
And from my experience with patients with whom I have worked, it can be boom in some instances, or gradual in others, that it starts off minimal and then it becomes more severe or extreme over time. And so to Dr. Choi's point earlier, of screening earlier and throughout the patient's birth and childbirth experience, and then into the pediatric care of the child, that there's screenings to determine, is this a single episode, is this something that was just passing and transient, or something has become chronic and now extreme or severe.
And I guess, and Dr. Troy, maybe you could help us with this too. Your depression as a mom can definitely affect the health of the baby.
Yes, and one of the studies I'd love for people to be aware of is the adverse childhood experiences. The study that looked at the fact that there are 10 indicators of things that people can experience before the age of 18 that can have a dose response long-term impact on health and access to health and perception of need for help. So it really is vital. We're talking about toxic childhood if people get the accumulation of these adversities without getting mitigation through counseling. And so they carry that load into every experience and every interface that they have. If they've not had the opportunity to first acknowledge what kind of trauma they've been through and have some opportunities for healing.
Do you think that some moms, because they're depressed, they might not be as nurturing, I guess, maybe, and that could have an effect on just the immediate health of the baby.
And because the symptoms of depression are excessive sleep or perhaps withdrawal or isolation, and so then it looks like not nurturing, right? Because they're sleeping and they're not attending to things that they otherwise would attend, and so it would impact the newborn child.
Yeah, because I guess with the depression, you are not paying as much attention to yourself or to anything else, maybe.
Right.
Whereas if you were on your game, you would be tired, but you would be able to do other things for the child.
Right.
Okay. Is there anything you can do to help yourself as a patient? Dr. Troy?
You always tell patients to write down all your questions and all your concerns and keep a little journal about things that you want to go over, because I know with the fast-paced timing of appointments, it can feel for patients that they don't have an opportunity or they can't bring to mind what they intended to talk about. And so it also to really read, because there's so many wonderful resources out there. And we like to get people who are able to have self-efficacy, that sense of empowerment by looking into and reading about whatever they're seeing in their family or in themselves or in their history. Again, that sense of empowering yourself, that your past experiences and trauma do not predict your future, that there's so many ways through mental health counseling to remediate whatever trauma someone's been through.
Does it help to have friends too, like you get together with new moms, those kinds of things?
Sure,
like groups?
sure, absolutely. And I appreciate that point of self-advocacy. You are your own best advocate. And if you don't advocate for yourself, others may not necessarily know to step in and advocate with you or for you. And so I like the idea of writing down your questions. Of any questions that you have, go into your appointments with your provider with all these questions, and then check them off as they're being asked. And if they're not asked, or answered rather, to your satisfaction or to your understanding, ask it again until you're satisfied within what's possible in the time constraints to get your concerns assuaged or your questions answered.
Mm-hmm. That way you've answered everything, because you're not going to go in, I don't care what your mental health is, you go in to a doctor's office, sometimes you forget.
I always forget.
I know.
When I go for my medical checkups, I forgot, I meant to say this.
That was the thing that bothers me the most, and I didn't say it. That was on my list. Okay, that's really great advice. What do you think about the camaraderie of new moms, Dr. Troy? That's got to be soothing, maybe helpful. I don't know.
It absolutely normalizes all the good and the struggles of being a new mom or being a parent along the lifeline of taking care of children. To not feel like you're uniquely feeling disappointed or sad or too hard on yourself. That feedback from another mom who's your mentor, as well as someone new going through it with you, can be a lifesaver.
My guess is maybe they can also be like the person who recognizes that something else is seriously wrong too, and help you that way.
Absolutely.
Yeah. Okay. Well, Dr. Troy, thank you so much for joining us and for talking about this with us. We really appreciate it.
Thank you for the opportunity. Thank you, Dr. Salgado.
Thank you.
Okay, Roy, any final tips before we go?
Yes, it is important that if someone is struggling with pre and or postnatal depression and anxiety, to clearly express what your needs are as Dr. Troy said, advocate for yourself. Get enough information to make informed choices. So the way that you get information is to ask appropriate questions, to do the research yourself and talk to your provider about it. Get information about other resources, and so just do the homework yourself so that you can be a better advocate or more effective advocate. And if necessary, have an advocate, family member, or friend with you to come in and make sure that the things that you need to be addressing with your provider, that they can reinforce and or remind you and support you in that, so that the provider and the team collectively can meet your need and that you be heard.
I love that. That's great advice. Take somebody with you.
Yes.
You know, they hear things you don't. They say things you might not.
Right.
Yeah. Okay. All right. Well, thank you, Dr. Roy Salgado. And of course, our guests today, Dr. Troy and Dr. Bolden, and all of your colleagues at the University of Holy Cross for helping us. Thank you for watching and being a part of Coping Today.